channel. So look for that change. I wish I could tell you a timeline, but everything is a little bit off. So I want to say in the next week or two, but I'll let you know next time I chat on this video. So 3 important groups to manage in COVID-19 in this pandemic that we are experiencing. And I think you may wonder what I'm talking about. Am I talking about the elderly or the people that have autoimmune deficiencies, autoimmune diseases? No. The 3 groups I'm talking about that we need to manage, and maybe manage is a stronger word than I wanted, but it's 3 groups to take care of. Who needs our care? And those 3 groups are ourselves, first and foremost, our staff, if we're in leadership positions, or even in, those alongside you, doctors with doctors, nurses with nurses, aides with aides. So take care of ourselves, take care of our staff, and take care of our patients. And you may find that order a little bit unusual. You might be like, whoa, if I'm a healthcare worker, I have to take care of my patient. Yes, you do. But if you've ever traveled on a plane, they repeat this information all the time about emergencies. So they give you this information before you take off, and it's how to, buckle your seatbelt and so forth. And they always go through this. And in a case of an emergency, the oxygen will drop out. Please put on your mask first and then assist others, your child, your whoever. You can't help anyone if you haven't taken care of yourself. So that's a basic premise, and that's why I think these 3 groups are really important, particularly during these times, but always, always. It's just everything is a little bit more intense right now. And that is because this pandemic, this worldwide pandemic with the COVID-19, and I know I spoke about a month ago in March about the numbers not being so severe, that probably 30,000 or more people have died from the flu during the past year, and that, the percentage was very small. So I think that is still the case. Actually, I'm not sure. I think the numbers have really risen more than I expected, but it's hard to say percentages and total numbers while we're still in the thick of it. And then the percentages even for the flu, to find out who had the flu and who died from the flu, those percentages are just almost impossible, because a lot of us suffer the flu and don't show up, don't go to the hospital, don't, get extra medicine. We just sort of suffer through it miserably. So if it's not reported, how do you create the data? But so with the flu, we know that there are X amount of deaths, and it averages every year, and it starts at about 12,000, and it's already up, I think, in the United States to about 30,000. So the numbers are climbing with the COVID. The thing with the COVID is that the not knowing enough about it, people not having been tested. So that data will start to appear throughout, the next months, and certainly we hope by the end of the year we know more. Many of us will be tested. We'll know who maybe were asymptomatic and developed antibodies, and those that had it, they're reporting their back for labs to see if antibodies are showing up in their plasma and so forth. So that's going on. But yeah, this pandemic has caused a lot of, this disaster has caused a lot of distress and it's certainly a tragedy, and the loss of lives is affects everyone. It's, um, doctors, basketball players, um, religious people, religious, I don't want to say religious leaders, priests and monks and ministers. Nobody is immune to the things that affect humans. So, so this is what we're dealing with. And so I'm going to talk and speak to, you'll hear me say the word psychosocial. And psychosocial is the realm of taking care of the psychological needs, the mental health needs, the physical needs, the social needs. So cultures are different, and religious, spiritual beliefs are different. All of these are going to be affected. And so when you hear me talk about that term, I am talking about that need. If the three important groups are have psychosocial needs, then you, the healthcare worker, have psychosocial needs. Your team, right? Your staff, they have psychosocial needs, and your patients have psychosocial needs. Yes, they have physical needs. Healthcare and wellness, we usually think of physical safety and physical health and wellness, right? So we don't want to see disease and the side effects of disease and treatment for disease. I'm always trying to get centered, and I always look off center. I think my chair needs to be replaced. I'm pretty sure about that. So that's kind of what I'm saying. The important groups to manage is I really, really feel and believe, and it's documented, and you can go to all kinds of resources from the American Medical Association, AMA, to the CDC, to all the nursing organizations, to know that a person's mental and psychosocial well-being are just as important as their physical well-being, okay, and safety. Okay, so how do you care for yourself? You care for yourself by checking in with yourself, right? Where am I, and how do I feel? And I'm having these feelings, and what am I doing with them? Am I pushing them down? Am I avoiding them? Am I just going to stay busy and work and forget that I am in the middle of this pandemic and on the front line of this pandemic? So here's some recommendations. Number one, you take care of yourself however you have always taken care of yourself, or if you've just sort of had a rosy time of it, which most of us don't make it to a certain mature adult age without having maybe not this level of tragedy and distress and loss that's created by the pandemic, but have had our ups and downs. So do what you do that works, and if it's not working, you try something else. So mindfulness, checking in with yourself. Gosh, I wake up and I'm just still so tired. What's going on with me? So mindfulness. Some people practice meditation, prayerfulness. At meditation, all of these things that I speak to are not easy. I'm a very ordinary person myself. So meditation takes a lot of practice. Start off with 5 minutes. I remember going to a group one time, and it was through one of the missions here in California. And it was this very quiet pastor, very unusual, than any of the pastors I had come across throughout my life. And he would have us do, centered something called scented prayer. To me, it was very much like meditation, and it wasn't easy. Every time we'd close our eyes for, 1 minute, 5 minutes, whatever, and then he would suggest for us to have a word, whether your word is peace or, Brother John or whatever, whatever your word is, sunshine, moonshine, I don't know. Meditation is a practice, and practice makes perfect, right? So meditation may be something for you to calm yourself and to be in a better place. Another thing, the feelings you're having are really real, because the surge in demand for your knowledge and practice are very, very, very intense now. Whether you work in a skilled nursing facility, an acute facility, an ER, or maybe the demand for your talents are not there. Like they switched in a lot of the acute hospitals. The ORs became ICUs, right? So the OR staff are temporarily laid off. They have a lot less work, or maybe they have to retrain to go into another area that they're not as comfortable with, So whatever the feelings are, because there's that of having more demand on your services, which nurses, especially the young nurses, the newer nurses, they are just expected to manage so much, and people are so ill and so demanding, because they're nervous wrecks as well. And you deal with all these personalities, all these different psychosocial groups. So I'm hearing from newer nurses that it's an impossible job. They're always worried that they're just going to lose their license or lose their cookies on the job, and just, why did I choose this? Why did I work so hard? Why did I study so hard? It's very, very stressful to begin with. Then you add this piece of having to be prepared for this pandemic that nobody, I don't think, ever expected it. Although Bill Gates talked about it a few years back. You're fearful of infection yourself. Yeah, well, that stands to reason. But practicing what you've always practiced, the bloodborne pathogens, your precautions and so forth, is very, very helpful. So you are a little more prepared than I think some of the grocery workers and so forth. And then I think this sort of what's gone on over the last month, right? It's changed. Every day we've heard, oh, it's optional to wear a mask, or, the information coming into your facility from authorities has changed. So that's distressing. So feel your feelings. They're normal. You could feel any emotion you want: sad, mad, bad, angry, frustrated. Very natural feelings. So you're entitled to your feelings, and they are very real, and they need to be addressed. So then the second step in taking care of yourself, and just focusing on the self here, but I do want to get to taking care of your staff if you're a leader, and taking care of your patients. To be sure, you have to take care of your patients. But these things come first. Remember my likeness to being on an airline. You have to put the oxygen on you, because if there's a lack of oxygen in the cabin and you pass out, how do you help the child next to you, or the disabled person sitting in front of you or behind? So yeah, we do have to take care of ourselves. So one of the ways to take care of ourselves, hang on a second, stay hydrated. Okay, I wasn't going to say that, but I'm staying hydrated. Is to have intentional ways to cope, right? So we talked about meditation, prayerfulness, mindfulness. There's also visualization. If you can take a break, go into the restroom, go where you have to, go outside, close your eyes wherever you are, and visualize yourself on the beach, and maybe, hear the waves, wherever. Maybe it's in the mountains. Maybe it's sitting under a tree. So visualization is one way. Another way is to physically rest. Okay, not just, you know, make sure you get your 7 or 8 hours every night, but to doing your shifts. If you're doing 12-hour shifts like so many of us do, or even 8-hour shifts, that's 8 long hours where you're on your feet the majority of that time. You're giving, you're providing service most of that time. Your brain is constantly working. You're adding all of this new information about protection for you and the patient with the COVID, and teaching, a lot of extra teaching probably going on. So allow for rest and respite. So when you can, you take some time out during your workday, and certainly in your off time, to get your good night's sleep. But rest when you can. You know, just rest your mind, close your eyes. You know, I have some vision issues, not anything intense, but you know, I have distance and nearsightedness and farsightedness. I have the whole gamut. And so sometimes I'll just take off my glasses and close my eyes. Or sometimes I'll just, if I'm doing a lot of reading on the computer, I'll just, you know, put something close to my eyes to just give those muscles a rest, you know. So all of your muscles, the brain muscles, the eye muscles, the body muscles, they all need a little bit of rest. So allow for some of that. Let's see, what did I write here? Oh, regular meal breaks. Make sure before and after work, have regular nutritious meals. Because I can remember being young and stupid and young and, you know, just, you know, plow through without the breaks. Barely have enough time to drink some water, some coffee, and go to the bathroom. Not the best thing to do for yourself. And you want to maintain your mental health, your psychosocial health, and your physical health. We're holistic. We're all of those things, right? We are our mental health. We are our mental persons. We are our physical persons. We are our social persons. We are our cultural persons. You know, we have all these pieces that make up us into our individual who we are. So, okay, so meals and rest and recognizing your feelings, and what else? What did I leave out? Physical activity, duh. You know, so a lot of us can't be as physical as we were. Okay, I mentioned basketball players, right? The games are over. All those areas, all those gyms and stadiums, and so they're closed. We can't even go to the beach. So, so it's difficult. But for me, it's walking. For some, it's bicycling. For some, it's just stretching, yoga moves. I was walking, oh, I think it was yesterday, actually. I was walking, and there was a couple, I don't know if they were a couple, but a young man and a young woman. They had mats out in front of their house, and they had weights, and they were bent over doing this and doing that. I didn't get too close, of course, and I have my noisy little dogs, so I kept my distance. But I thought, oh, good for them. They're exercising right outside in their own driveway, not bothering anybody, and taking care of their bodies. So, and their minds, you know, the whole piece was there. So, and then, yeah, the social distancing is very difficult, and it really breaks my heart for those that live alone and are more isolated. But stay in contact, feed that emotional need with the people you love and care for, your friends and your family and your neighbors. Stay in contact. Send a text, send a funny joke, email, some photos. I have baby pictures. I'm sending them to everyone pretty much on a daily basis. I should bring a picture in here one day. She's such an angel. Anyway, yeah, oh, today's her birthday. She's 4 weeks today. My new grandbaby is 4 weeks today. She really is very, 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 very sweet, but she's not letting her mother rest very much. You know, when you only eat 2 ounces, you know, it wears off quickly. Anyway, So those are the things I recommend. Monitor yourself, check in with yourself, allow for your feelings. And if you monitor yourself and you see some things that maybe you're not getting a good night's sleep, you know, you're having bad dreams, the distress you feel during your work day or even on your days off, you know, the memories are there. You may have lost a patient. I mean, us in healthcare, that happens. That happens. It may not be like if you work in a clinic. I keep getting a tickle in my nose. Excuse me. Keep getting a tickle in my nose. You know, if you're working outpatient, you work in clinics and so forth, skilled nursing or even the senior living and so forth, whatever, you may not see your patients every day. Like working in an ICU, you're with your patients for hours and hours and hours, and then there's a demise. It's so distressing. How can that not affect you, you know? So, but then you may, like I said, if you work in a clinic situation or a doctor's office and so forth, it may come down the pike. Your patient hasn't arrived for an appointment and you make that phone call, or someone in the team is making those phone calls, following up with patients, and you find out your patient had COVID and passed away, or they're not coming in because their spouse may have passed away. So those things, all of those memories take their toll on you and can be intrusive to your state, to your mental state, you know, and your psychological and so forth, and if it's affecting your sleep. So check in with yourself, monitor yourself, and know when you need help. And if these things are happening at the work site, take a moment and go to your supervisor and schedule some time with your supervisor. Let them know, you know, I really feel I need to speak with you, and let them know whatever it is. You know, I really, I can't shake the feeling of what happened last Thursday with, you know, Mr. Jones or Mrs. Jones. And check in with your supervisor because they are trained and they are in a position to help you. If things are not getting better, or if you're not comfortable going to your supervisor, which you're completely entitled and I encourage you to do, having been in all these roles, you know, having been the staff person and the leadership person, I know that these are things that they can and should and are obligated to manage. And I experienced it from both ends. I remember having a distressing home health situation with a family member in the home, and I went to my supervisor and explained. I said, you know, things are getting really odd there, and so they moved me to another case, and you know, they know this is their job, you know. So anyway, if that is not comfortable for you, you go through your own health care. You talk to your doctor, your nurse practitioner, let them know you're not sleeping well, you have feelings of hopelessness, you're just so distressed and so anxious that you really feel that you need extra help, and get the help. You know, things can turn around just as quickly as things go from bad to good all the time, right? So like the weather, right? Okay, so that is taking care of yourself. What about taking care of your staff? And this is directed more to the employers, to the leadership in organizations, healthcare organizations, hospitals, nursing homes, long-term acute care, the LTACs we've talked about quite a bit, skilled nursing facilities, senior living, assisted living, all of these areas. The leaders should, absolutely should, maintain the basic infrastructure that they're obligated to abide by, right? By all the guidelines, right? The guidelines of the state, the guidelines of the federal, the guidelines of the disease control, CDC, Center for Disease Control. So they must maintain those basic infrastructures. But then additionally, they have to support the staff by protecting them during this pandemic. So that's going to require additional training. It's going to be take a lot of skill to manage getting additional things done when things are already kind of stretched tight to get everything done that's needed to get done. But they have to do that, and they have to recognize what their staff needs. They have to anticipate it, right? So they have to anticipate the needs actually before the problems arise. And that's leadership's job. They should, if they don't already, have something in place for that moment that I just spoke about, and taking care of yourself. Go to your supervisor. Have something in place for your staff. Direct them where they can go to get the support. So maybe somebody's providing some kind of counseling or some kind of training classes and so forth. They may need some additional breaks. I mean, isn't it better to provide the additional break when somebody's in a really distressful place? Maybe they're getting to the point where they're weepy because their patients aren't doing well, and they've, this is their 5th day in a row or whatever reason. Maybe just give them that break. It's better to give them a break, to nip things in the bud, to let them, you know what, go get some tea, go outside, take 10, 15, 20 minutes, whatever. I'll check back with you. We'll cover your patients right now. Take a break. Something a leader could do also, if it's feasible, it depends on, I talk so broadly about all these different healthcare situations. My experience has been much more acute, but I have had I took care of chronic dialysis patients. I have had home health experience. I have had some hospice experience. The majority of my career was more acute, intensive care and acute settings and so forth. And in some of those settings, you have your seasoned staff. I mean, I've been around for a long time, since the 70s, doing clinical nursing. And so you might have somebody that's just their first year since they got their license and they're practicing. So if you could team the more experienced, and if you're a good leader, you will see, it depends, like, again, on the size of your staff and the type of unit or the type of clinic or the type of facility you're leading, how you can do this. But if and when you can do it, or just have a mentor in place. But if you can team a newer worker with a more seasoned worker, and personalities that mesh better, So if somebody is very, very quiet, maybe you want to pair them with somebody who is also very thoughtful and quiet and knowledgable. So you pair those two types. If you have someone who is more technologically savvy, and you have a staff member who is very skillful in applying the care, but just has a lot of reservations working with new computers or new programs and so forth, maybe pair them with someone who is a great assistant with that, who is very comfortable and knowledgeable about the technology. So think about that. Would reduce stress, right? Maybe there's a lot of new things coming in, with the PPE, and that's new. That skilled nursing facilities probably haven't, used goggles in years, and everybody's used to how to, apply gloves, how to do good hand washing, how to apply a mask and so forth. But when it comes to the hoods and the HEPA things and the N95s and so forth, they may not be as well versed as somebody that works with that regularly. So have your staff. Sorry, I'm very itchy nose today. I don't know. Anyway, It's very dry. In Southern California, it can be very dry. Ways that leaders can take care of their staff is very, very important. What else did I write over here? Oh, yes, I think I said that. While you're reinforcing safe practice, right, and safe usage and knowledge of the PPEs, you also want to reinforce, just like in taking care of yourself, you take care of the physical, but just as important is the mental and psychosocial needs. So be prepared and provide access to those psychosocial and mental health needs, because they're just as important. And if you don't know what the access to that is, then you, in your leadership role, need to go to your corporate leaders or the higher, the VPs and the presidents and so forth, and ask them, where's the manual? Who do I call? How do I provide? What do I tell, the staff member who's really just having a very difficult time, but she's normally really, he or she is really a normally strong team member, but it's just having extra additional stress at this time. That's how you support, that's how you take care of your staff. So let's talk a little bit about the patient, why we do all this, right? Why we do all this. And I will say, that's a good reminder for yourself and your staff, is we do this because we want to take care of others, right? And we should feel, I read one doctor saying that one of the more significant things that has occurred in his hours and hours over the last 2 months of taking care of ER patients and COVID patients and so forth is a renewed, it fortified his feeling of why he became a doctor. So he felt very, very good about that. And I have to say, in my career, many, many times I felt fortified, not only by the practice that I was doing, but sometimes in my colleagues. They're just their compassion, their knowledge, their speed in situations. I honestly can literally remember being right next to a patient that I was had been in for a same-day procedure, had done fairly well, met all the criteria, and as I was, I think, almost to the door, taking her to go home, had given the family member instructions and the patient instructions and so forth, that the patient, as she got out of the wheelchair that was exiting the hospital, we were actually still in the lobby, but her husband had walked in, so he wanted to walk with her, from the lobby door right to the car that was right out there. She's going down, she's fainting. And I can remember one of my colleagues zooming down, and I was right next to her and being right there to catch her shoulders and her head, and was absolutely I was just so fortified that I had that kind of support and help. And I remember that more than the whole, I think we did have to bring her back to the unit and reassess her and so forth. And she did go home that day. She was okay. It wasn't, we weren't losing a heart or a lung or anything, but it was a moment. It was a very stressful moment for the patient, the family member, and myself and the nurse. But of course, we went into motion what to do and so forth, did our assessment, kept her safe. But I was just fortified in my fellow RN being, out of the corner of his eye, seeing down the hall where we were. And he just zoomed up. Who knew we could move that fast? Anyway, so I just wanted to add that is another way to care for yourself, is to allow for a little joy and fortify yourself with the knowledge that you're doing a noble job, that you know what you're doing, and that you can feel glad for the team that you work with and for yourself. Okay, so now we want to talk about patients, and we want to be sure about their mental and psychosocial well-being as we are for ourselves and our staff, because it's just as important as their physical health. You know, the reason they are patients is usually often physical unwellness, that you want to get them back to wellness. And so there usually is a system in place. There usually is, regardless of what type of facility that you work in, there usually is a system in place, or, you know, somebody, a go-to person that that has the knowledge that is needed for that, that level of care, that the time and place. If in part of the assessment, you know, say you're assessing someone preoperatively or pre-admission to a skilled nursing facility, and it's all about the hip replacement. They're coming from a couple of days post-op and so forth. You're assessing what was done and how they are and the wounds and blah, 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 and the family and the social and the cultural. And you notice like a real flat affect, or you notice a high level of agitation. So this is maybe more than the admitting nurse can handle, and that's when you bring that to the attention of your supervisor, and that's when the team members that can take care of that can assess the mental health, the psychosocial needs, bring in whatever is necessary, whether it's a social worker or a psychiatrist or a psychologist and so forth. That is a way to care for the patient, okay? And those things are rising more during this distressful time of a pandemic. So we're dealing with more than the hip, right? Okay, sorry. Cheers. Okay, that's a little bit of vitamin C in my water. How do we, in addition to that, we employ the team that can help with that. But what's the expectation of the most of the healthcare team to provide for the patient? And that is a sense that you, if you're the nurse, if you're the there's just so many members of the team. I go to nurses mostly because I am a nurse and I understand that, but respiratory therapist, radiation, x-ray techs, special procedures techs. There's just so many team members that come in contact with the patient. Nurse aides, med techs. A lot of times in the assisted living, you don't have all LVNs. They're usually supervised by an LVN and an RN and the director and so forth, but they're called med techs. This is very specific work that these people are doing. They're under a lot of stress, but they also are in contact with the patients. So what's important for all of these healthcare people, the doctor from the bottom up, the doctors and the specialty doctors, to even, the environmental workers, people that are keeping the environment as clean as possible. Boy, they must be stressed out right now. I know we're Cloroxing everything. We're following every direction we can because we have this beautiful baby with us, and her mama, my daughter, has had a lot of cold symptoms, and so we're super clean. We're super clean right now. Anyway, but how do you take care of the patients? We go back to our fictitious patient of having a hip, being admitted to skilled nursing for status post hip surgery, and you start to notice some questionable behavior, high anxiety, and so forth. What can you do personally to help your patient cope. And you can let them feel that they are dealing with somebody that is efficient. You can help them recognize that the community they're coming into, the healthcare community, the team that you work with, works with great efficacy. That means the world. I have had patients tell me, well, this hospital seems just like they really know what, and I say yes. Or they'll be anxious, pre-procedure. And I'll say, I'm going to be right here with you. This is the role I have. The therapists are going to do this. And then your doctor is fabulous. I've worked with him many, many times. And I can confidently tell them that if they just listen to his cues, if they're going through a procedure and he says, hold your breath or whatever, I can tell them. And I can tell them some people do find it uncomfortable. Some people don't. You let me know because I'm in charge of taking care of your comfort. So if they feel that their team is working with great efficacy, it makes a huge difference in their level of anxiety. And touch does as well. You can put a hand on a shoulder. You can hold a hand, etc. So that's one thing. A sense of safety. People, I've experienced this so many times over the years. And then with my own mother, when she became disabled, she is paralyzed in her entire right side. And she's gained a lot of knowledge in how to move and transfer safely. She worked with occupational physical therapist, aides, assistants to the physical therapist and so forth. And then with unskilled people like my husband and didn't always feel safe. And I remember when we started creating ramps at our house and her house, and I'd be, heave-hoing up a little ramp with her wheelchair and have to stop to take an extra breath or something. And I go, do you feel safe? And she'd be like, no, I don't. And so, making your patients feel safe. So we would stop and laugh at that point. Mother would be like white knuckling it with her one good hand. But a sense of safety, creating a calmness, being calm yourself, whatever it takes. Many times in my career, taking care of ICU patients and different situations where I really was concerned because I wasn't getting the attention I needed from my team members. And, my concerns were rising, and I did a lot of conscious sedation, if you all know about that. There would be times, when vital signs are changing and so forth, and I'd be reaching out to the doctor who's behind a mask and behind, lead and not communicating well and so forth. So I had my levels of anxiety, but I stay calm. And so that when you're calm, and then in very critical situations, knowing what to do is very, very helpful. Like that lady starting to faint in the lobby of the hospital on her way to discharge. Your sense of calmness is so valuable to your patient. That's again, makes them feel like they're with people that are going to really save their lives, makes them feel like they know what to do and be efficient. So creating a sense of safety. And finally, what did I want to say? Oh, to create hope. So patient is being admitted, and it's during this time of disease and the virus, and people are dying from it, to create hope. And how you can do that is just be honest. Let them know, yes, we are practicing, our practice now includes safety measures for the COVID-19, and there may be times when, we have to wheel you to the physical therapy that you'll have to wear a mask, and just let them be hopeful. They should be hopeful. That's what we are. We're hopeful. We're a hopeful group of persons. We go from ill to well. So, so I think creating those kinds of, whoever you are on the team, if you work efficiently, if you work calmly, if you provide safety, you stay connected socially, you know, just being human. How are you? Remembering their name. How are you, Mr. Jones? It's good to see you today. You actually have more color today than you did yesterday. That's great. Have you talked to your grandson? Wonderful. You know, just little human connectedness, even though it's behind a mask. We're wearing our mask. Oh, next time I'll have to show you. My neighbor's mother-in-law made 2 beautiful masks. So I'll bring them out next time and talk to you through that. But that's what I wanted to talk to you about. I'm not sure with my title that you knew where we were going, but it's very important to manage the care of yourself, the care of your staff, and the care of your patients. And in that order, right? Put your oxygen mask, your metaphoric oxygen mask on first. Okay, I've talked for a long time. I apologize. Have a great day. I'll check back in with you soon, and be and stay safe. Thank you.